Thanks, Anne-Marie. Now, sufferers of Lyme's disease will be protesting outside the Department of Health in London today over what they see as the ignorance of the illness in the NHS. Lyme's disease is transmitted by the bite of an infected tick, and more than 3,000 people in the UK are known to have it. Early symptoms can include a fever and headache, but it can lay dormant before developing into joint pain, nerve and even neurological problems. Nicola Seal from Aberdeen is leading today's protest. Good morning to you, Nicola.
Good morning.
First things first, you're from Aberdeen, but you're protesting outside the Department of Health. Why is that?
Well, we're protesting outside the Department of Health because we feel that the Department of Health isn't listening to the concerns of patients, and Scottish policy is going to probably, on Lyme disease, is probably going to follow English policy.
OK, so I understand. You want the Department of Health in London to take this message on board, as do the Scottish Government, in your view.
Yeah.
So, talk me through, what happened to you then? How did you become infected?
I first got sick in 2008. I was on the west coast on the Isle of Rum. We were on a walking holiday and watching some deer, and there were lots of ticks about. But I'm an entomologist, so I wasn't really bothered by them. I got one tick bite that I found about a day later. I just scratched it off with my fingernail. I wasn't overly bothered, but about 11 days later I started to get really quite sick. I got a severe flu-like illness with chills and fever, but no runny nose, sore knees, sore stomach, and then I developed signs of meningitis. I went to the hospital, and by the time I got to the hospital I couldn't actually walk. It affected the nerves in my legs, so they weren't working.
And I know you've had to pay for your own treatment in the United States. Why do you think the NHS is failing in this regard?
The NHS usually gives treatment for Lyme disease is limited to a short course of antibiotics around the 30-day mark. Biologically, that's a nonsense. We know that the bacteria can survive short course of antibiotics, even several months of antibiotics. When it's established in the body, it's actually quite difficult to eradicate. Early treatment for Lyme disease is much easier, and short course of antibiotics can be successful in treating early Lyme disease. But too often it's misdiagnosed. It's not really recognised in the NHS. Doctors aren't very well trained in it. So too often people go undiagnosed for a long time. It becomes established, and then it's hard to treat. But there are studies which show that it is treatable by long course of antibiotics. And the patient experience, for instance, my experience and other people's experience, shows that when you do get long-term antibiotics, usually by paying for it yourself, like I have, that works and you can regain full health. I got my health completely back for 2.5 years until I relapsed last year. I had to pay for 19 months of antibiotics to get that. Briefly,
Nicola, lots of us will be out and about this summer where there are deer, as is indeed the case in Rum. We might pick up a tick. What should we do?
It's best to try and remove the tick as quickly as possible. So check for ticks when you get back from a walk. Before you go on the walk, put repellent on, wear long trousers, long sleeves, and stick to paths. Don't roll around in heather and bracken. Remove the tick properly. So your aim is not to squash or stress the tick. Use a very, very fine tip forceps, but if you haven't got those, a tick remover tool is good. You can buy them on the internet or at vets. If you're out in the wild and you haven't got any of those things, a loop of cotton looped around the base of the tick and pulled upwards.
Nicola, we'll leave it there. Good advice. Thank you very much indeed. Nicola Seal there, a campaigner on Lyme's disease. 7:50.